In this case, we have an existing denture. It's got a fracture through the midline, and we sent it to the lab and had it repaired. And he can wear it, but we're going to make him a new one. He likes the denture. It fits well, likes the looks of it. So we've taken the denture and we're going to place a co-soft liner. We've already painted a separating medium on the outside of it, everywhere that we do not want the co-soft to stick. So the external surface and the teeth, everything except the intaglio surface. So we will mix up our co-soft. I've already pre-measured it. This stuff scans beautifully. I personally like this better than even a PVS wash material for this application. So we're mixing up our co-soft slowly and steadily, ensuring that we don't have any bubbles. And we'll begin to pour it into the intaglio surface of the denture slowly, trying to keep out any bubbles. Pouring it slowly, letting it coat the entire inner surface of this denture. Some of it will run out, we'll catch it. That's okay. There's going to be excess that runs out. We do this exactly like we were making a wash impression for a reline, or just placing a regular tissue conditioner. For example, following an immediate denture during healing, we've got a little void in the palate. We're going to add a little bit more there. We're going to capture what's flowing out the back. We're going to tell our patient, take a good swallow for me, and we are going to insert this just like we are taking a final impression. Posterior first and seating to the anterior. We're going to border mold with this. We're going to take our cheeks and lip and border mold this impression. Open really big and move your jaw from side to side. Good. We're going to exercise all these muscles of mastication. And we're going to tell the patient, close down firmly for me. Make sure it's their natural bite. A little bit more border molding. So the patient's going to hold firmly for 5 minutes. We have waited 5 minutes for our co-soft to set up. So we will remove it now. Should have some pretty good suction, and there will be plenty of excess. And that's exactly how we want our denture to sound when it comes out. Now we can see we have a perfect impression of the intaglio surface. We have some excess that we are going to go and trim off that we do not need for our scan. And then we will 360 scan this relined denture. We have sprayed with the quick check to knock down some of the glare, and we are going to 360 scan this. So we'll use our scanning protocols just like we're scanning for anything else. We will begin in the posterior. We will roll around to the buccal, capture some more of the posterior teeth, roll around to the palatal, and we will quickly get to the intaglio surface. This allows the software to stitch this together better by rolling it around very quickly like that to the intaglio and then back around to the occlusal surface. The software has more trouble stitching the denture together if we do all of the posterior teeth and then move around to the anterior teeth and then the posterior teeth like we would on a normal intraoral scan. But because we're doing it extraorally, we can do it in this manner, and it does allow the software to perform better. Remember that we do not want to hover over one spot very long at a time. This makes it difficult for the software. It gathers too much information. It makes it difficult for it to process. So now we are scanning our posterior area, rotating it around to the external surface and back to the intaglio surface. In this case, we are doing a copy of this denture. We want to get absolutely every bit of this denture scanned externally and internally and get it back to our patient. The patient likes the way the denture functions, likes the way the denture looks, likes the way it feels. So we're making him a copy of it. We've got everything except for the palate, which is always going to be the hardest area to scan. It's got the most smooth surface. That's one reason I really like CoSoft for this application, because of the texture. It seems to scan better than a PVS material, which is slicker and tends to have more glare. So you can see how we've already gotten the entire intaglio surface of this denture and the palatal aspect, which can be difficult at times. So now we just have to finish out the palatal external aspect of this denture, gathering a few areas that we haven't gotten, filling in all of our empty spaces. Anytime the scanner stops picking up, we go back to an area that it has already scanned and registered, hold very briefly, and then proceed to the area that it has not picked up. You can see the difference in texture. What we're seeing is the intaglio surface where we have not scanned the exterior surface yet. So we've got to fill in those holes, which we have almost completed. Scanning around to an area that we've already gotten, and then back to an area that we have not picked up. This will always be the hardest area to scan. The external palatal surface right in the middle of the palate is the most reflective area. See if we've gotten all of it. See if we missed anything. It's looking pretty good. I think we've got it.